Symptoms are the worst way to judge your health. We all know this, and I'll give you 2 stats that prove that. If you look at heart disease, which is the leading cause of death in the United States officially, heart disease, 50% of the time when people have heart disease, the first symptom they feel is the heart attack that kills them. So if we're waiting for the symptom to tell us when to get treatment, 50% of the people who die of the leading cause of death are waiting too long. If you look at the second leading cause of death in the United States, cancer. I ask people, can you have cancer and not have tumors? Everywhere I go, everybody asks, says yes. And I say, for how long? And they say for years, which is true. So symptoms are the worst way to judge your health. They're the worst way to judge when somebody gets better. And it's the worst way to decide whether somebody is overutilizing care or not. If you're improving function, and you can document function, which is what we teach, you can prove what you're doing is helping that patient. But we're not relying on insurance anymore. America is realizing the insurance was covering those vaccines, the government was paying for those vaccines, and they didn't work. In fact, now we have 15-year-olds dying of heart attacks, athletes. And it's not occasional. I've heard of more teenage boys dying of a heart attack on an athletic field in the last 4 years than I did the entire 58 other years I've been alive. America's starting to question everything. And they're going, if you can show me how you can help me without hurting me, I'll even pay for it. You have to know how to ask them for that money, which is why we have a sales course. We teach you how to have a team that asks for the payments to get the services that you deliver that will save these patients' lives. Let's just look at this a different way. Let's look at the market. Chronic degenerative arthritis, pain from chronic degenerative arthritis is the most lucrative part of healthcare. If you look at what pain generates, this is without physical therapy, without chiropractic, just the pain market, which is mostly medication, it's $800 billion a year. The Institute of Health Metrics and Evaluation at the University of Washington Medical School says 60% of that is for spinal pain. That's in our wheelhouse. We treat spinal pain. Are we going to treat the pain, or are we going to treat the function? If we treat the function, we should get paid for it. But that 60% is $460 billion a year. And the only profession I know that's actually making traction in functionally treating it is chiropractic, probably physical therapy right alongside it. So you look at that, chiropractic only generates $15 billion, and you go, that's a lot of money. Yeah, for one person, but you divide that across an entire profession, treating the most common ailment that human beings suffer with. We're not even paying for the cherry on the cake. The drugs are taking all that. They're taking the cake, the plate, the knives, everything. The money they're generating is beyond belief. And those drugs do not do anything to fix the patient. So now is the best time for chiropractic. We just tell them what we do and how what we do works. You're gonna have people coming to you and they're gonna want services. There has been an assault on chiropractic to trash our name. It was to say that we were dangerous, and we proved that wasn't true. When I graduated school in 1991, cover of Time magazine, chiropractic linked to strokes. And I thought, man, I picked a bad time to graduate chiropractic school. But when I read the study and I started looking at the numbers, I realized the average chiropractor would have to be in practice for 600 years to have it happen once. Then you could say, yeah, there's a link, a very tiny link. In fact, in the study, they said it's more likely that you would have a stroke from getting your hair washed. It was more likely that a plumber working underneath your sink would have a stroke because of the position he was in compared to chiropractic. So we proved what we did was safe. We even got the president of the American Heart Association to say it's more dangerous to take a baby aspirin than it is to get a chiropractic adjustment. So that kind of backfired on our opponents. But what didn't is when they say, oh, they overutilize care. They rip you off. They treat you when you don't have pain. And what we need to do is educate the American public about what is function versus pain, and that everybody has a different pain tolerance, and it's a bad way to judge the health. If we can do that and get medical providers to work with us to educate the public, that would give us validity. And there are many that are willing to do it. I know that during COVID, I think President Biden said that 38% of all the healthcare practitioners got fired from the hospital because they refused to get a vaccine. That's the people you're looking for. Those people are willing to say, I'm willing to lose my job than do something I don't agree with. That is people with integrity. You find somebody like that and you give them systems, which we help teach, on how to treat things functionally and get results functionally so pain goes away and stays away and you don't have to keep taking these pills. You're gonna have a friend for life. And if we do that, we will get over the tipping point. If you're familiar with Malcolm Gladwell, he talks about the 15% tipping point. We're at 10%. Chiropractic has been at 10% for 130 years. And nobody wants us to get beyond that because they know if you hit 15% of the population game over, we win, everybody wants it. We just need 5% more. If you're willing to work with medical providers who think very similar to what you do, you can get a lot of people to come in for care and get results, and that will push us over the 10%. Now is the best time for chiropractors to thrive. If you want to learn more about this, is what we talk about all the time, and we have systems in our businesses to help you thrive and to help you get paid for what you do. We're not ripping anybody off. We're actually delivering services that Americans need to end the insanity of chronic back and neck problems and knee problems and hip problems and foot and so on. If you want to know more about that, somewhere on this page is a link. You can click on it. It's either below me or above me or it's drifting up the side, but find that link, click on it, and it'll connect you with somebody to talk about our blueprint. It's talking about a blueprint that helps you to learn about these systems where you can actually get more people under care and get chiropractic to get the recognition it deserves. And that's how we're going to thrive in this market.